What is the Goldilocks approach to stimulation, and can you explain what that means and who benefits most?
Yeah, so the Goldilocks approach is something to stimulation, to IVF stimulation or fertility medications, is something that I've developed over many years of practice. Honestly, I think any woman who's doing fertility treatment could benefit from this approach because what it does is it takes so there's a standard way of doing IVF, which is very high dose multiple injections. That's still widely practiced. And then there's the other extreme, which is mini, which is no injections at all. But I really think a middle ground approach is better, where you want just the right dose of medications to get a good quality group of eggs to grow. And you do that by adjusting medications through the cycle, by looking at the hormones through the cycle and getting a just right dose of medications, which honestly tends to be less intense, not so many injections. But it's also an approach that looks at, okay, if the eggs need some injections, we'll use injections, but it tends to be a more moderate dose, and that really works well for most women, I would say, but especially important for women over at age 40 or over doing IVF, or women with low AMH, because those higher dose protocols often can backfire for that group of women.
Mm-hmm.
Yeah.
So now many women over 38 and 40 are told they need aggressive stimulation. When might less be actually more?
Yeah, I think especially I've had many patients come to me where they've had very high doses because the thinking is we should push more medications. The eggs aren't responding. We need to push more heavy medications and then the eggs will respond. But what can actually happen is that it's almost like the eggs get really overwhelmed by that high dose and they stop growing altogether. So in the more extreme cases is I've seen patients who've come to me with canceled cycles and say, you can't respond to IVF. It's not an option for you. You should start looking at other options. And really what they needed is that more nuanced approach, because the eggs can grow if they're given, again, just that just right approach, really looking at FSH levels throughout and doing a just right, not overdoing it approach.
Are there specific biomarkers you rely on beyond AMH and age?